Hello, I'm Hendrik Schulz. I'm the Chief Medical Officer for Medical Associates Clinics and Health Plan, and I'm board certified in infectious diseases. I would like to give you an update on the current situation with the COVID-19 pandemic. The question that you were probably asking yourself after we've been in this for 1.5 years is, where are we now? And I want to talk a little bit about that and what we can do and have to do and what we can probably expect going forward. So first of all, what I can tell you is that we're in a much better spot than we were about a year ago when we had a surge that affected us heavily here in the community. The numbers we can see in the hospital are way below of what we have seen last November. The number of severely ill patients is also much lower than what we had seen then. We still see a significant amount of infected patients, but most of them seem now to be on the outpatient side. And the reason appears to be twofold. One is that high-risk populations, like our older population above the age of 65, have been vaccinated with over 95%. And the currently unvaccinated population, the children below the age of 12, that started to get vaccinated now, usually have a rather mild course of the disease. So the group in between, let's say between 17 and 60, that has not been vaccinated is what we're seeing most right now as patients who get either sick and see their doctor or end up in the hospital. Overall, this is a very positive development that I can see in our community here in Dubuque, on the state level as well as nationwide. Where do we stand with the vaccinations? We also made significant progress there. We have 3 approved vaccines in the United States. One of them is fully approved by the FDA and recommended by the ACIP. That's the Pfizer vaccine. Moderna is short of being approved also with full approval, and Johnson & Johnson as well. We have learned that the safety profiles of all of these vaccines had been good and that they prevent severe disease, hospitalization, and death effectively. We also have learned that they are safe to be given to children down to the age of 5, and this has happened now, as you know, at the beginning of the month. This was implemented and recommended by the FDA and ACIP to be given to children between the age of 5 and 11. So we will actually make the group of unvaccinated people in our population that can be infected by the virus and in which the virus can multiply and mutate and cause further problems, we can make this number smaller and smaller and smaller to the point that the virus does not find a breeding ground or a ground where it can mutate. So we are all moving in the right direction, and everybody did a great job getting their part done so far. Now, what do we have for treatments now? Last year in November, the only real options we had were remdesivir and plasma from recovering patients who had COVID. We are quite a bit further at this point of time. We have a large array of monoclonal antibodies that can be used against COVID that are much more effective than the plasma. We also have new drugs that are coming out soon. One is a drug called molnupiravir, which leads the virus to replicate in a wrong way that does not work. And we have an older drug, ritonavir, that has been around for a long time, that has also shown great promise. And what that drug does is it actually prevents the virus from reassembling effectively before it gets out of the host cell and reinfects other cells. So both of these drugs have been shown to be very effective with an almost 90% prevention of hospitalization, severe disease, or death if they are given early. So that is also a great plus. I think that is wonderful, and we have a greater way to help our patients these days. Now, we are still not entirely above the pandemic, but we're moving toward the endemic part. And what does that mean? What do we see in the future? What can we expect? We can expect that COVID-19 will probably stick around, but I would anticipate that it will become an annual occurrence like influenza or RSV or other respiratory viruses will. What the same drill is with these viruses is that you do, when the season starts, your vaccinations, and you treat early when you can diagnose it and test for it. So I think this is what we can anticipate. What we still have to do until we entirely get there is do our part in the community. And what that means, and that is our recommendation based on the experience of the last 18 months, is to get vaccinated. If you qualify and you need it, get the booster shot. And since we still have a high community transmission level in Dubuque County and in the state of Iowa in most counties, use good judgment in wearing a mask and disinfecting your hand frequently when you interact with other people. Although the risk is much less than it was last year because more people are vaccinated, the risk is not entirely gone yet, and we do not know who gets affected. So thank you, everybody, for moving along and getting us this far. I think there is an end in sight, and we are here for you to help you through the last yards of this pandemic, and we get through this together.